Here we go again.
Concerning that cosmetic surgeries are normalized amongst young girls.
I would consider myself a young girl. I'm 26.
Interesting that one person didn't
at the end of the day,
step
when I
forward.
worry about like Botox and things that aren't really dramatic, like you can see I have plastic surgery, but the plastic surgery you can't see is what worries me the most. And I'm a little afraid of aging, I'm not gonna lie. So when I see like celebrities, they're like in their 40s or 50s, but they look 20, 30, do I have to do all of these things and stick needles in my face to maintain my youth? And that's what scares me the most.
So what, if you can share, what surgeries or what procedures did you go through yourself?
Yeah, I had 2 BBLs and 2 breast augmentations, and those are kind of like more dramatic ones, so you can like see that I did it. And I also am very open about it. I think it's very harmful if you try to hide it.
For me, I'm not a big drinker. I don't smoke. I don't do drugs. I regularly exercise. My elders who have aged well without plastic surgery, that was the lifestyle they lived. I've met so many young girls who have zero care about the toxic lifestyle they're living because if I don't age well, I'll just like get it fixed. It does target young girls to not care about consequences because instant gratification, and I'm not saying that's what plastic surgery always is, but I do think that when we are...
So there were other comments about how it's unfair to have a plastic surgeon in that conversation, and I think this is where I see it as problematic, right? Because here she is making this great statement about how plastic surgery can be instant gratification for people who live otherwise toxic and harmful lives, right? We don't promote that as plastic surgeons, not as a field, but you can't deny that is part of it, right? So you mean to tell me that I could get a bigger butt and a smaller waist, all I need to do is eat some cheese sticks and have a plastic surgeon suck it out, right? That's the message. Even I tell some patients to eat some cheese sticks because we need more fat to do whatever we need to do. Most of the time it's reconstruct the breast. But again, that's the idea, right? That I can tell them, hey, gain 5 pounds of pure fat so I can suck it out and give you bigger breasts after your breast cancer. Yes, it's great that I'm, addressing your breast cancer reconstruction concerns, but again, it's an instant fix, right? Don't worry about the weight that you've just gained. I'm gonna suck it all out. Going back to the original point, it is dangerous to have a plastic surgeon in this discussion because now she's like apologetically looking at the plastic surgeon being like, I'm not calling a profession, whatever it is. I'm just saying that this is has been my thought on this, but I'm not demonizing you. That's dangerous. Let's have an honest conversation and not be afraid to call shit and say, hey, what y'all are doing is preying on young women. As a plastic surgeon, I don't think I personally prey on young women, right? And I think I tell a lot of women, actually, you don't need that, you look great. But as a field, we can do better.
Have this culture of instant gratification. It's only amplified by telling them that you can just get whatever fixed later.
For example, on Halloween, there's this little girl, she has to be a toddler, maybe 4 or 5 years old. And she has the little pole for the IV and she has like a fake, gauze and everything. And she's showing that she got a BBL. Yeah. When I see a little girl who's mimicking someone getting a BBL, I'm like, okay, well, she's 5. What are you doing mimicking a BBL?
She doesn't even know what her body's gonna look like yet. That's really scary. I do have a question for you ladies, right? Because you're very Jessica Rabbit-esque, and I say that in a good way because I love Jessica Rabbit. Like, you're both clearly had plastic surgery, and you both have. I swore I looked natural. But both of you have mentioned having it young. Do you feel like you were too young when you made the decision?
For me, absolutely, because I started getting work done around like 16, 17.
You were a baby.
Yeah, but the thing was that I was a dancer in clubs. I was looking at other older girls where they had that very ba-ba-boom body. And I wanted that ba-ba-boom body too. They had the big boobs. They had they were making all the money. And when I started dancing, I was 18 years old, so I started doing Botox. Then I did a nose job. and then I did this, and I did this. I shouldn't have been thinking about that at 18, you know? Who's to blame for that? That's obviously a different discussion.
When I was 18, I got my first boob job. I was gonna compete in bodybuilding. Fitness was always a passion of mine before getting all the plastic surgery. And I thought I had to get implants to kind of like proportionately even out the rest of my body. I was getting like flat chested from the muscles and the chest days. And honestly, I don't regret anything I've done. I'm very happy and confident in what I've done to my body. I don't think I was too young to make the decision. I've stayed true to how I feel about what I've done and like my own personal decision, but I don't want it to affect young girls, so that's why I remain transparent about everything.
You think about the entrance of social media into civil society, and now I'll scroll through TikTok and it's like, are you a cat girl or a bunny girl? What type of pretty are you? Are you slim bodied? Are you BBL bodied? Do you have A cups? Do you have B cups? And it's just people who are really funneling girls down this path of wanting a specific body type, whatever the body type may be, and trends flow in and out. And then I'm seeing young girls who are saying, I'm going to the clinic to get preventative Botox. It's not that I even have wrinkles now, I want to prevent wrinkles down the line. Or I'm getting filler because Kylie Jenner has it, or a ponytail
I didn't want to say the name.
Yeah, right. Or they're even like, they're risking pulmonary embolism to get a BBL and all these different things. So
I went to a school that we had a lot of very privileged kids, and as soon as they were 18, I know multiple girls that got gifted, what procedure or surgery would you like? And that's insane to me.
As a mom, I'm just gonna say, but we need to teach our girls that your jewelry is your mind. Your jewelry is what you do for other people. It's not what you look like, and if you lose that, then you have, I had a patient actually who told me if I don't have my face, I have nothing. And I was like, well, maybe you should go back to school and find your something and find your purpose, because you can't put all your eggs in the beauty basket. Does that mean that beauty doesn't matter?
So I agree with her. I do agree with teaching explicitly. I don't have kids yet, but I do agree with explicitly teaching that your jewelry, in her words, is your mind, is what you have to offer. It's your purpose in the world. Yes, I agree that it's very important to be explicit with your children about what their purpose is, and that is what should drive them and should really be their focus. And it's not about being beautiful. I didn't know I was pretty until I was probably somewhere in college. Not because I thought I was ugly, because I didn't think I was ugly, but because for me, I had been explicitly taught, or the message was explicitly for me, school is the focus, right? Tiger parenting, immigrant mom, what do you, like, gotta love it, because it has some real purpose, right? But there was also this implicit message. There was an implicit message that she wasn't good enough. She talked to me a lot about the insecurities she had as a teenager, comparing herself to her sister and everything like that. And so, yes, there's explicit, but there's also implicit, and that's just as dangerous. And it can be just as empowering or just as dangerous. So as I look to have children in the future, I want to be conscious of what that message is I'm sending implicitly. And I don't know that we are enough in this society as deliberate about what our actions, our self-actions say about how we view our own worth and how that reflects onto growing girls who then interpret that and internalize that for themselves.
Oh, there was a 60 Minutes special, I swear, 20 years ago, that talked about how we are all inherently programmed to appreciate beauty. You know, they brought a teacher in front of a class of kindergarten kids, and she was an actress. She was dressed disheveled, and she gave that talk, a lesson to the kindergarten kids. They took the same person backstage, put her in a different outfit, fixed her hair in a ponytail so she looked less disheveled. She went out in the same tone of voice, same everything, gave the same lesson.
Yeah.
They asked the students, which teacher did you like better? They said the second one. They said, why? They said, because she's nicer.
Wow.
So we can't deny that beauty matters, and we're programmed to appreciate beauty, but that doesn't mean you put all your eggs in that basket, or that you teach your children to say that if I'm not beautiful in the standard that is current right now in this trend, then I'm worth nothing.
I agree.
I think because I'm 23 and I grew up with it, and I was the youth, you know, in the social media looking at you know, the Kardashians and I was young, and I think I'm fine nowadays. Encourage support, encourage acceptance, like things like that. Yeah, but you can look, you know, we have mirrors, we have eyes. Like your mom can tell you in your ear, you're the most beautiful girl in the world all day long. But if you're not treated like that at school, if you don't feel that way, you can see more attractive people on a daily basis. You can look in the mirror and see what you don't like about yourself. That's all gonna go in one ear out through the other.
I agree with that too. Someone can tell you you're beautiful and it doesn't hit like you telling yourself that you're beautiful. But here's the bigger question, right? Because there are girls. I'm gonna go back to me for a second. I grew up and I was teased mercilessly. I was teased mercilessly. There were a lot of things about me that at the time did not seem okay. I had big lips. I was tall. I was lanky, and I was ashy. I had really ashy legs too. So I was teased about, and okay, now we're just telling on ourselves. I was ashy, guys. And I didn't have the best clothing, right? I had Walmart and Goodwill to thank for that. And my hair, I didn't know what was happening with my hair. Sometimes I did, sometimes I didn't. So there were a lot of reasons to tease me, right? And so that added to, I didn't necessarily feel beautiful or pretty, or, you know, and there were some days I felt a little heavy coming home because it was just hard to be a teenager or a preteen. The same token, I didn't think that I needed to change my looks in response to the teasing, in response to internalizing that teasing. Maybe I got like a nice, you know, outfit from Rainbow or Old Navy, and that was more high brand than Walmart was, I guess. And maybe that influenced me to buy some Reebok classics. I'm dating myself, but you know what I mean? Like, that didn't make me go out and decide that I wanted to get an operation. So what's that difference? What's that answer? I don't know what that answer is. I have to think about why I didn't feel the need to do that, and instead, at the end of the day, when I was growing up and I was being teased, I still had some self-resolve to know that I was okay. It made me get some lotion though. I'm not as ashy anymore, so that's good. That's good.
Going back to this, like, is it a little more heightened with social media? Sure, but at the same time, like, a 13-year-old's algorithm isn't only girls with, you know, fillers. Like, and I think what you were saying, it all goes back to moms. Like, when I was a kid and I would, oh my gosh, that model is so beautiful. My mom, the first thing she'd be like, that girl does not look like that. She has all these fillers, all these face. Like, my mom's best friend was a makeup artist in New York City, and he was like, are you kidding? Like, none of these people look like that in real life. So I was just always well aware of that at a young age, and you know, having access to fillers, I would see girls, I would be able to spot the filler on a person, you know, or in filters. So I would know that these Instagram models were fake, and there were, you know, if you have Facetune, you know when a girl's Facetune. So it's like, you know it's fake, so I don't understand.
I think a lot of people don't know it's fake.
I think if we're gonna judge it based on an issue, for young kids in particular, the less that you're able to see the plastic surgery, the more of an issue it becomes, because they're seeing these individuals and thinking nothing has happened, and thinking that this is a beauty standard that this person achieved naturally because they can't really detect it with their eyes. And we sort of, I think, all grew up in an age where we didn't have social media, and then suddenly we did. We have to think about like Gen Alpha, who's growing up in a world right now where social media is the standard. They've never not known the internet. So if you have these imperceivable plastic surgery and cosmetic changes that kids are taking on, they're thinking that's a natural.
I mean, I kind of have. Like, I had Instagram at like 10 years old. Like, I was on the internet, you know, before that.
Right. But you watch the rise of filters, you watch the rise of Facetune, which makes you more attuned to be able to detect these things.
Yeah, because filters used to be so funny. Like, if we can go back to the dawn of Instagram.
Can I ask you guys a question?
Yeah.
Do you think that us as professionals in plastic surgery, if we put out more informational factoids about how to tell, like, oh, for example, somebody brought up the fitness influencers saying that I did squats, but they really had a BBL. Like, I went on maybe 3 years ago on my social media and said, you guys, if somebody doesn't have a hip dip, they had a BBL.
Yes.
So do you think that as you know, professionals, if we came out, we gave the younger generations the tips to be able to tell?
I don't know how I feel about outing people for their plastic surgery either. That seems dangerous too. I get people should be more discerning and be able to know that it's not natural. I don't know that's a little bit invasive for me too. I think that comes back to the idea of like, there's a sense of pride if you are natural. And so the converse of that is that should there be shame because I had plastic surgery? That doesn't jive either. That doesn't make sense to me either. So I don't know that I want to necessarily publicize how to tell good plastic surgery so that you can accept your own beauty. Like, I don't think that works either.
Someone's had something done, would that be helpful
Could help
for
her, sure.
I would personally love that.
I have a question for the plastic surgery side. If you're planning on having children, if you have children, what is that conversation about cosmetic surgery going to look like with them if at a young age they come to you and say, I'm really interested in this, or, you know, I'd like to get this procedure done when I'm old enough?
Fair.
I think for me, it would be honestly how I would tell anyone, right? This is your decision. I think with the little education that I do know, I would definitely make sure they understand that, you know, there's pros and cons to it, right? You're not gonna just wake up and be totally happy that you did something and that's it, right? There might be, now you see that you're gaining weight, so you're, oh, okay, maybe I'll just do BBL now, you know, or maybe I'll do this, etc. I think it'll be very important to let them make that decision, but give them the best education.
But again, that comes back to my question of like, so if your daughter saw that you got all this work done, even if she came at a time and didn't realize that you had all this work done, she sees you and then she looks at herself. She sees you and then she looks at herself. She sees you and then she looks at herself. The message is going to be either one, that my mother is beautiful, but I look nothing like her. Not knowing that you'd had all the work done, right? The lies and deceit are real. And I'm not trying to be funny and insensitive, but that's true. If you had all the plastic surgery done, your kids are in for a treat because they're gonna be like, oh, yo, I don't look like that. Why don't I look like that? And whether or not they know or they don't know, the message is still the same, that I am not good enough because this person that I love and dear and look up to said to herself over and over again, every time she went under the knife, that she wasn't good enough, as is. So therefore I am going to internalize that and not be good enough. It's a very dangerous game.
And then obviously get a professional that can help you with that. I don't know if I can tell anyone to not do something. I could only give them my advice and my experience. And I think it'll be hypocritical for me to say, hey, listen, you shouldn't do this. I don't agree with it when I was 18, you know, getting a nose job.
I think I have a shitty answer, but I don't really care. I think I'm just gonna give them the honest feedback I would give anybody. Like, I'm sorry, I'm sure my daughter is gonna be the most beautiful girl in the world, whatever. If her nose is really bad and she's really insecure about it at a young age and she comes to me and we have the financial means to do so, I probably would be the parent, like, hey girl, like, get your nose done for graduation before you go to college. I know that sounds really shitty.
No,
but like,
it doesn't. It's
that's
real.
a shitty feeling.
Kinda does.
Looking in the mirror and like crying all the time about your face. You don't like your nose. You don't like whatever it is. Like, I know a girl who got a chin implant.
So I don't want to be super judgmental, even though I have the capability to be super judgmental. But it is a little shitty to say I don't care, and if you want the nose job, go ahead and get the nose job. I say this as a woman whose parent has been encouraging of her getting plastic surgery. My mom said to me once that she would have gifted me a nose job for my 18th birthday. I like my nose, so that I thought was a little bit of a dig and a little shady on her part. But the point that I'm trying to make is that there needs to be this balance, right? There needs to be this balance of like teaching your kids it's okay to be who you are, but also encouraging them to do what makes them feel like their best self. Saying I know she doesn't literally mean I don't care. She does come off that way, so it's a little hard for me to like have a good response to that because it just feels a little bit like, you really don't care, do you? You really don't care.
Changed her whole face, like crazy. Had such more, yeah, I don't know. I mean, obviously, am I going to be like, listen, you're doing a big thing. We're going to get educated. We're going to the best doctors. We're going to figure it out. And if I have the financial means to do so correctly, hell yeah.
I think also what's the purpose you're doing it for, who you're doing it for, because people end up doing plastic surgery for boys. So I think it's very important to ask too, what's the reason for you doing it?
And we do that, and it's very important for the surgeon to also ask. I have it on my questionnaire, my intake form. Has anyone told you should do this?
Yeah.
Has anyone made you feel bad about this area? Mental health questions. I think, as it is for a mom to ask their child, it's also very important as us as the gatekeepers to also make sure they're doing it for the right reasons.
Honestly, I didn't have too much.
What are the right reasons,
I
though?
agree with both of them in the same vein, and I don't plan to have kids, but I do plan to be a role model for younger girls, nieces, nephews, nieces, and I would just honestly do the same thing that Giselle would, just educate them. I wouldn't judge them. I would teach them about their self-worth, doing things a natural way first. And just
Let it not be your default.
yeah, exactly. Not just go straight to surgery.